Hello, today we are going to talk about depression. So I have some questions in front of me that people commonly ask, and so I will like to answer them in front of you. First of all, what is depression and how is depression different from normal mood? Yeah, all of us at certain point of time in our life do feel sad. It's a normal emotion, and if a person never feels sad in his life, I think he is abnormal. So depression is definitely something that happens all of us. But when it is a disorder, it's a disorder when it shows some abnormal symptoms. When it persists beyond 2 weeks, we have a cutoff point. When it persists beyond a very long period, we have a cutoff point for that, and it's 2 weeks. And if there are some associated symptoms, if when it starts to affect our sleep, our daily activities, our socio-occupational activities, our attention, and most importantly, our thoughts, our hope and everything. And when we become hopeless, when we become suicidal, definitely the depression becomes a disease. Can depression affect anyone? Yes, it can. Yes, it can. What are the risk factors for depression? Anything that happens around us can cause depression. Modern life is not immune to stress. It can happen to anyone, and all these things can lead to stress. And one more thing that I want to stress upon is that even if there is no stressful factor, depression can be there, because depression is, after all, some neurochemical imbalance within the brain. It's not always necessary to have something in our surroundings to cause it. Does every person with depression needs treatment? And what are the treatment options? No, it's definitely not. If it's mild, most of the people don't need treatment. But if it becomes too much, if it starts hampering the occupational and social life of the person, then it may need options, treatment. Treatment does not mean taking some sedative pills. Treatment may be some very good drugs which are absolutely devoid of any major side effects. You can take them and carry on your activities as usual. Treatment may be counseling if you opt to. There is no problem with that. But treatment is essential if there are some other some significant distress in person. What can you do if you think that you are depressed? First, talk. There is no point in being ashamed of feeling depression. Depression is not a symbol of weakness, mental weakness. If you have depression, talk to someone. Talk to your friends, talk to your families, talk to your relatives. And if necessary, talk to any caregivers, any mental health professionals. We are there, psychologists are there, and various counselors are there. They can help you out. Talk. That is most important. And don't hesitate to seek treatment if you feel it's becoming too much. How can you help someone with depression? To help someone with depression, as I have said, you must make him seek treatment. Seeking treatment of the depression is very essential. You should not be ashamed of seeking treatment of depression. That is very essential. And talk to the person. Don't ostracize or stigmatize her. It is very important. He may need your support, and with your support, he may leave or not. Thank you.